Hello friends, today we are going to talk about depression and inside fire which burns you slowly. Depression is being colorblind and constantly told how colorful the world is. Atticus. It is the description of depression very beautifully given by Atticus. I am Dr. Jagatjit Singh Virk, MBBS, FCGP, FAMS, PGDGM, presenting to you this session. What is depression? Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. It's also called major depressive disorder or clinical depression. It affects how you feel, think, and behave and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel as if life isn't worth living. What will happen during depression? Depression is a serious mental illness that can interfere with a person's life. It can cause long-lasting and severe feelings of sadness, hopelessness, and a loss of interest in activities. It can also cause physical symptoms of pain, appetite changes, and sleep problems. What happens to the brain during depression? There is growing evidence that several parts of the brain shrink in people with depression. Specifically, these areas lose gray matter volume. That's the tissue with a lot of brain cells. Gray matter volume loss seems to be higher in people who have regular or ongoing depression with serious symptoms. Key facts about depression. Depression is a common mental disorder. Globally, it is estimated that 5% of adults suffer from depression. Depression is a leading cause of disability worldwide and is a major contributor to the overall global burden of disease. More women are affected by depression than men. Depression can lead to suicide. There is effective treatment for mild, moderate, and severe depression. An overview. Depression is different from usual mood fluctuations and short-lived emotional responses to challenges in everyday life. Especially when recurrent and with moderate or severe intensity, depression may become a serious health condition. It can cause the affected person to suffer greatly and function poorly at work, at school, and in the family. At its worst, depression can lead to suicide. Over 700,000 people die due to suicide every year. Suicide is the fourth leading cause of death in 15 to 29-year-olds. Who is mainly affected by depression? The percentage of adults who experienced any symptoms of depression was highest among those aged 18 to 29, that is 21%. Followed by those aged 45 to 64, that's 18.4%, and 65 and over, that is 18.4%, and lastly, by those aged 30 to 44, that is 16.8%. Women were more likely than men to experience mild, moderate or severe symptoms of depression. Symptoms of depression. Although depression may occur only once during your life, people typically have multiple episodes. During these episodes, symptoms occur most of the day, nearly every day, and may include feelings of sadness, tearfulness, emptiness, or hopelessness, angry outbursts, irritability or frustration, even over small matters, loss of interest or pleasure in most or all normal activities, such as sex, hobbies, or sports, sleep disturbances, including insomnia or sleeping too much, tiredness and lack of energy, so even small tasks take extra effort, reduced appetite and weight loss, or increased cravings for food and weight gain, anxiety, agitation, or restlessness, slowed thinking, speaking, or body movements, feelings of worthlessness or guilt, fixating on past failures or self-blame, trouble thinking, concentrating, making decisions, and remembering things, frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts, or suicide, unexplained physical problems such as back pain or headaches. What causes depression? It's not known exactly what causes depression. As with many mental disorders, a variety of factors may be involved, such as biological differences. People with depression appear to have physical changes in their brains. The significance of these changes is still uncertain, but may eventually help pinpoint causes. Brain chemistry. Neurotransmitters are naturally occurring brain chemicals that likely play a role in depression. Recent research indicates that changes in the function and effect of these neurotransmitters and how they interact with neurocircuits involved in maintaining mood stability may play a significant role in depression and its treatment. Hormones. Changes in the body's balance of hormones may be involved in causing or triggering depression. Hormone changes can result with pregnancy and during the weeks or months after delivery, that is postpartum, and from thyroid problems, menopause problems, or a number of other conditions. Inherited traits. Depression is more common in people whose blood relatives also have this condition. Researchers are trying to find genes that may be involved in causing depression. Early childhood trauma. Some events affect the way your body reacts to fear and stressful situations. Brain structure. There is a greater risk for depression if the frontal lobe of your brain is less active. However, scientists don't know if this happens before or after the onset of depressive symptoms. Medical conditions. Certain conditions put you at a higher risk, such as chronic illness, insomnia, chronic pain, Parkinson's disease, stroke, heart attack, and cancer. Substance misuse. A history of substance or alcohol misuse can affect your risk. Pain. People who feel emotional or chronic physical pain for long periods of time are significantly to develop depression. Risk factors of depression. Factors that seem to increase the risk of developing or triggering depression include certain personality traits such as low esteem and being too dependent, self-critical or pessimistic, traumatic or stressful events such as physical or sexual abuse, the death or loss of a loved one, a difficult relationship, or financial problems. Blood relatives with a history of depression, bipolar disorders, alcoholism or suicide, being lesbian, gay, bisexual, or transgender, or having variations in the development of genital organs that aren't clearly male or female, intersex in an unsportive situation. History of other mental health disorders such as anxiety disorder, eating disorders, or post-traumatic stress disorders. Serious or chronic illness, including cancer, stroke, chronic pain, or heart disease. Certain medications, such as some high blood pressure medications or sleeping pills. Talk to your doctor before stopping any medication. Vitamin D deficiency have linked depressive symptoms to low levels of vitamin D. Gender identity, the risk of depression for transgender people is nearly fourfold that of cisgender people, according to a 2018 study. Substance misuse, again, about 20% of people who have a substance use disorder also experience depression. Medical illnesses. Depression is associated with other chronic medical illnesses. People with heart disease are about to have depression as people who don't, while up to 1 in 4 people with cancer may also experience depression. Complication of depressions. Excess weight or obesity, which can lead to heart disease and diabetes. Pain or physical illness, alcohol or drug misuse, anxiety, panic disorder, or social phobia, family conflicts, relationship with difficulties, and work or school problems, social isolation, suicidal feelings, suicidal attempts, or suicide, self-mutilation such as cutting, premature death from medical conditions. Preventative steps. There is no sure way to prevent depression. However, these strategies may help. Take steps to control stress, to increase your resilience and boost your self-esteem. Reach out to family and friends, especially in times of crisis, to help you weather rough spells. Get treatment at the earliest sign of a problem to help prevent depression from worsening. Consider getting long-term maintenance treatment to help prevent a relapse of symptoms. Coping and support. Talk with your doctor or therapist about improving your coping skills and try these tips. Simplify your life. Cut back on obligations when possible and set reasonable goals for yourself. Give yourself permission to do less when you feel down. Write a journal. Journaling as part of your treatment may improve mood by allowing you to express pain, anger, fear, or other emotions. Read reputable self-help books and websites. Your doctor or therapist may be able to recommend books or websites to read. Locate helpful groups. Many organizations such as National Alliance of Mental Illness and the Depression and Bipolar Support Alliance offer education, support groups, counseling, and other resources to help with depression. Employee assistance programs and religious groups also may offer help for mental health concerns. Don't become isolated. Try to participate in social activities and get together with family or friends regularly. Support groups for people with depression can help you connect to others facing similar challenges and share experiences. Learn ways to relax and manage your stress. Examples include meditation, progressive muscle relaxation, yoga, and Tai Chi. Structure your time. Plan your day. You may find it helps to make a list of daily tasks. Use sticky notes as reminders or use a planner to stay organized. Don't make important decisions when you are down. Avoid decision making when you are feeling depressed, since you may not be thinking clearly. Natural remedies and lifestyle tips. Exercise is one of the best to boost your morale. Avoid alcohol and substance abuse. Learn how to set limits. Take care of yourself. Supplements semi omega-3 fatty acid, 5-hydroxytryptophan, vitamins B6, B12, and D, minerals, zinc, and magnesium are the other ones. Complication of depression in nutshell. If left untreated, complications of weight gain or loss, physical pain, substance use disorder, panic attacks, relationship problems, social isolation, thought of suicide, and self-harm. These were the few of the facts of depression. I think these might have helped you in understanding the basics of depression, and you must have got some benefit from this talk. You just subscribe my channel and give me likes. Thank you very much.